And in fact, this conference started a little time back. And that was in November, when already we have been going through almost 2 years of the COVID pandemic. And as you remember, Chief, the Omicron virus was detected by scientists in South Africa. And it was really a very, very critical time to reflect on the importance of collaboration between Africa and Europe in the world in how we address and fight this pandemic. And so you requested me and VC Professor Mpeza Mihigo and my colleague Ronald de Jong with the request if we wouldn't share a joint statement on the need for more collaboration. And so we did that, and within 24 hours, we had a long list of signatories, and this statement went to both Dr. Tedros from the WHO, as well as Dr. Borrell, who chairs the external relations of the European Union. And while Dr. Tedros has been sending his greetings to this conference and really wished that he would have been here, he just traveled from South Africa, where he received the Ubuntu Prize for Extraordinary Achievement. And so he requested that we read both the statement and the response that he has sent to you, Chief Charumbira, and to all of the signatories of this letter. So I'm going to give the floor now to Dr. Anthony Ong'ayo to read to us both the statement and the response of Dr. Tedros, the Director General of the World Health Organization. Dr. Anthony, you have the floor.
Good afternoon, distinguished audience and participants of this critical conversation between Africa. Following these insightful reflections by Honorable Charumbira, I wish to convey the communique that was put together by a large body of scholars and leaders whose concerns have been expressed by Professor Dr. Miriam van Rijssen. And in this communique, which was dated 29th of November 2021, the scholars and leaders that were touched by the impact of the outbreak of Omicron decided to express several views here. And I wish to state this in simple terms. They say we, over 100 academics and leaders from Europe, Africa, US, and elsewhere, are very concerned with the lack of action for vaccination in Africa and solidarity with Africa. The COVID-19 variant of concern, Omicron, reported by South African government on 24th of November, must result in a reset of the global response to curb the pandemic. The science is absolutely clear. Until everyone is vaccinated, no one is safe. While 63% of people in high-income countries are fully vaccinated, just 1.4% of people in low-income countries are fully vaccinated. That is according to Amnesty International, quoting our World in Data figures. The vaccine inequality is also shocking. Rich countries have been buying most of the world's supplies without any strategy to fulfill the needs of low-income countries. The emergence of Omicron points to the need for global solidarity as a moral imperative, as well as out of sheer self-interest. A global strategy to fight pandemic must include a plan to protect Africa. New variants of concern will continue to emerge and are likely to become increasingly dangerous in the absence of such a strategy. There's no way that isolation of Africa could be the solution to this problem. We ask that the response is based on science. The leadership is required in order to act now, and this should include financial and technical support for the establishment of vaccine production sites in Africa. They also need to have an immediate plan to transfer vaccines to Africa to start widespread vaccination programs. Assistance in widespread vaccination campaigns for building trust in the effectiveness of vaccines. We ask that the European Union, together with nations around the world, to stand together in solidarity and for all responses to be based on science. Sincerely, all the scientists that have been concerned, and the list is long, as has been pointed out by Honorable Charumbira. It spans different countries in Africa and across Europe and America. Thank you very much for listening.
Dr. Anthony, would you also kindly read the letter that Dr. Tedros sent in response to this appeal?
In response, a letter came back on the 17th of January, 2022. And in response, he says, I thank you for your joint letter of 29th November, 2021, expressing concern and requesting a global response regarding collaboration with Africa on COVID-19 following the Omicron outbreak. Your letter raises the critical issues of vaccine inequality and the need for global solidarity, of which I strongly agree and have been urging since the onset of the pandemic, and which the World Health Organization, our COVAX partners, are working tirelessly to address. WHO and partners have established the Access to COVID-19 Tools Accelerator in April 2020 to mitigate inequity, to help accelerate not only development, but equitable access to COVID tools globally. WHO recommendations on COVID vaccination have been and will continue to be driven by the principles of equity and fairness. Vaccine nationalism threatens to prolong the pandemic. The emergence of variants such as Omicron reinforces this reality. Going beyond the moral imperative, WHO continues to advocate for global solidarity, arguing that there are health and economic benefits from countries working in a coordinated manner to end this pandemic everywhere. Recognizing that only 1% of vaccination produced is currently located on the African continent, we understand the urgent need to greatly expand this capacity, not only for the current pandemic response, but to strengthen regional health security to better respond in the future. The COVAX Manufacturing Task Force is working to address this through a number of impact-driven streams. In particular, the long-term sustainable manufacturing work stream is focused on expanding capacities of existing manufacturers in low and middle-income countries and establishing sustainable capacity in regions where no such capacity yet exists. The mRNA Technology Transfer Hub, established in South Africa in July 2021 by WHO and our partners, aims to increase access to mRNA vaccines on the continent by establishing manufacturing capacity using a technology transfer hub model to sustainable vaccine security in future pandemics. At the same time, COVAX is working tirelessly to secure supply and deliver doses to all participants at risk of not meeting global vaccination targets. By the end of 2021, COVAX had shipped over 900 million doses, including 279 million doses to African countries, approximately 30% of its overall shipments. In the last 3 months, shipments to Africa have increased considerably and will continue to do so in 2022. WHO and other COVAX partners have been working with ministries of health to develop and implement national vaccination deployment plans, including providing technical assistance and support for regulatory authorization for vaccines, tools, and trainings for healthcare workers, strengthening adverse event surveillance and monitoring systems, cold chain planning and deployment, enhancing data systems, including electronic vaccine records, and support for vaccine demand, and crisis and risk communication advice. WHO, along with UNICEF and Gavi, have recently launched the COVID-19 vaccine delivery facility, whose aim is to intensify the operational support to countries whose rate of vaccination is not at a point that will achieve global coverage targets. We are working to support country governments to unblock all bottlenecks that are constraining turning vaccines into vaccinations. This is an ongoing effort, one toward which all partners are needed and encouraged to join. I assure you that WHO and all partners in COVAX and the ACT Accelerator remain firmly committed to the fair and equitable provision of COVID-19 vaccines and the other tools which are critical to ending this pandemic. I'm sparing no effort in pushing for a substantial and urgent increase in vaccine supply for the countries that need them the most. Yours faithfully, Dr. Tedros Gebreyesus, Director General. Thank you.
Thank you so much, Dr. Anthony, for reading this important letter by the Director General of the WHO, Dr. Tedros, and really thank you for doing that. The letter is very insightful.